Hey everybody, Milkman Al here. As many of you know, I'm actually a board certified anesthesiologist somehow, and to most people that just means that I'm the guy who shows up and sticks you with a needle and then disappears, never to be seen again. So I get lots of questions when I'm on stream about what I actually do for a living. Like, is it true that Sudoku is actually incredibly difficult? Is everything in the operating room really my fault? How many coffee breaks do I actually get every day? So let's talk about all those things. I'm fresh off a 24-hour call, so what better to do with my day off than talk about work? So we'll answer all those questions and more. So for anyone interested in a career in anesthesia, or just kind of interested in healthcare in general, or for people who aren't really convinced that I actually have a job, this video is for you. So before we get into everything, why don't you go ahead and like and subscribe this video? It'd really help me out. And don't forget to follow live on Twitch and YouTube at 8 to 10 p.m. Central Time, Wednesdays and Sundays. I'll be here live chatting it up. Also, don't forget to follow us on Discord. Links to everything are down below in the description. So we'll go through this in a couple parts. Mainly what I do every day, what my job actually is, what a typical day for me is like, and then what my lifestyle is like. So first we'll go over what I actually do. So basically my function is to keep people safe, and function 1B is keep people comfortable, control pain. So presumably if you're meeting me, you are signed up for somebody else to have you poked, stabbed, chunks cut off you, whatever. All that stuff hurts. So you need somebody to take care of that. And what most people, I think of when they consider anesthesia is meds. Lots and lots of really good drugs. And man, I got a ton of them. So we got everything from Tylenol to fentanyl to Dilaudid all the way up to ketamine. We got tons of stuff to control pain. And all of those drugs, with maybe the exception of Tylenol, can potentially be pretty dangerous. So that's why I have a job. So you need somebody who's really experienced with all those medicines to kind of mix and match them the right way so that you minimize side effects but also maximize pain control and benefit from all of them. If medicines aren't good enough, then we have some more invasive measures that we can do. So things called nerve blocks, which is basically where we just take a needle and inject a whole bunch of numbing medicine right next to, a major nerve. Those can be very effective, and the things that pregnant women really enjoy are labor epidurals, which is pretty much just a different kind of nerve block. So we can get a little bit more invasive if we need to, but we try to just do stuff with IV pain medicines if at all possible. So like I said, the second part of my job is safety. So how do we go about doing that? So the primary thing that we want to protect is your airway, because you die real fast if you're not breathing. Most people start to lose their oxygen saturation in about 2 minutes or so, even with 100% oxygen in their lungs. And if you're unhealthy, it's way faster than that. You start to get brain damage around the 5 minute mark, so there's not a whole lot of leeway there. So what we do is we either put something in your airway, either something called a laryngeal mask airway or an endotracheal tube that actually goes into your trachea to let us breathe for you with a mechanical ventilator, or we just kind of do your surgery under deep sedation. Now, that's not always an option, but if you can get away with it, it's great because recovery time is better. So we just actually just look at you and make sure that you're breathing and, that your vitals look good, and that's that. So we do monitor your vitals very closely. There are a series of standard monitors that we have to use to meet standard of care according to the American Society of Anesthesiology, or ASA. And those vitals include things like your heart rate, your oxygen saturation, your blood pressure, your temperature, that kind of thing. If we need to, if you're really sick, we can place more invasive monitors, kind of like the pain control thing. We can get poke and prod as much as we need to get the information that we need. We can place things called arterial lines, which lets us monitor your blood pressure continuously. Things called central lines, which let us see the pressure next to your heart, and also give you medicines right next to your heart as quickly as we can. We can even fish a catheter into your heart to measure the pressure that your heart is pushing into your lungs. And those things aren't necessary for the vast majority of people, but they are things that we can do if we really need to. All right, so what's a typical day like for me? So generally I get to the hospital about 6:30 to 6:45, and the first part of the day is by far the busiest, and it's filled mostly with paperwork. So we show up, we go see all of our patients, make sure that there's not any huge oversights or dangerous things that may be coming down the pike. We take care of the nerve blocks that I mentioned, and basically just get everything all set up for the first surgical start, which is at 7:30. Now, we manage 4 operating rooms at the same time, and basically most of my job is management and oversight. And when you have a whole bunch of surgeries starting all at once, that gets really hectic. So you have to do a fair amount of triaging and just figuring out which people are going to need your attention more than others. And of course, emergencies happen, but you are literally a 10-second walk away from anybody who needs your help immediately. And we also have some extra people kind of waiting in the wings to, cover things that are unforeseen and, emergency situations that need an extra set of hands. And since administrators have such a firm grasp on exactly what kind of business they're running and how it works, all of our meetings are scheduled for this time as well. So thanks for that, guys. So after all that, it's time for a coffee break, right? Get everybody to sleep, everything's cool, you hit cruise control for a little bit. Nope, you see the next wave of patients. So there's only 2 of us running our operating room, and typically we have about 40 cases a day. So that means that each of us sees anywhere from about 15 to 25 patients. So we are really busy and we're running around, and some of those cases are really fast, so you have to be there when the patient wakes up, because that's probably the most dangerous part of anesthesia. That and when they go to sleep. So those are the things that you need to be there for primarily. So all of those things start just kind of hitting throughout your day, and you got to keep up. And again, keep triaging if things hit you at the same time. And you just kind of circulate and do your best to make sure that everything goes according to plan. Which brings me to what I actually do with the bulk of my day, which is managing stuff. So we make sure the OR schedule flows as it should, and we manage our personnel and make sure that all of the operating rooms are staffed appropriately. The operating room is basically the breadwinner for the hospital. It's pretty much what drives every single healthcare facility that has an operating room in terms of revenue. So it's really important that it works very efficiently, and it's also just better patient care, more importantly. So in addition to making all of the scheduled things run smoothly, we have to ensure that the unforeseen stuff that I mentioned earlier gets slotted into the schedule in an efficient way, because those are generally the people who are in more dire straits. They have an emergency situation crop up that they need emergency surgery for. And, so it's imperative that they get going as quickly as possible. There's a saying regarding stroke patients that goes something like time is brain. And you can apply that to pretty much anything else in healthcare. So basically, the more you delay an emergency situation, the worse off the patient's going to be. So it's really, really important that you get them taken care of as quickly as possible. So what that means is that we need to be available to basically put out fires in the emergency room, the ICU, just in the hospital in general, in OB, in all these different places. And so while we're super busy in the operating room, we have a couple doctors running around basically just fielding all of those calls and making sure that everybody's taken care of appropriately. And it's organized chaos for the most part. My group in particular produces about 85th percentile nationally, so we are exceptionally busy. We work very efficiently and do our best to put out a good product and take good care of people. So despite the fact that we do produce at such a high level and are extremely busy during the day, we actually have a pretty good lifestyle. So overall, I work about 50-ish hour weeks, and that includes an average of a 24-hour call. So there's 7 of us in our group who take call. So that means that on average, I'm on call every 7 days. But when you factor in vacation, I'm actually on call like once every 3 to 4 proper working days, and we take 15 weekends per year. So that said, the overnight call is generally pretty tame. Like, for instance, last night was one of the busier calls that I've had, and I was up until about 12:30, and then went to sleep and woke up at 6:30. So I got 6 hours uninterrupted sleep. It was awesome, and I'm here talking to you guys. So what that means is that the days after our call are generally true days off, so I have the day free. I took my kid to school. I'm here making YouTube videos. I'm probably gonna, go get some lunch later and just kind of go to the gym and hang out, enjoy myself. And I don't have to, recover or be fatigued all day long. No, it certainly happens. There are days where you just get your ass handed to you, but that is few and far between, and most of the time you can kind of come home and enjoy a proper day off. In terms of income, despite my absolutely ridiculous student debt, we're totally financially comfortable. I'll post a link below to a site called Gaswork, which is basically a listing of all the available anesthesia jobs. So if you're curious, you can have an idea of what an anesthesiologist gets paid in your area, but I assure you it is quite a comfortable lifestyle. There's plenty of cash to fund all my ridiculous hobbies like Warhammer 40,000 and drinking really nice bourbon and, building PCs and whatever else. Work hours per day vary dramatically. Like I said, we have pretty frequent 24-hour calls, but sometimes you work an hour and you go home. So it's really unpredictable, which is mixed blessing, sort of. You can pretty frequently make appointments during the week, during business hours, but sometimes you also have no idea when you're going to get home, and that kind of sucks. You're always at risk of getting stuck at the hospital with some like giant emergency case that lasts a couple hours, that you didn't expect, and it just like tacks on extra time to your workday, and there's nothing to be done because you can't, stop that. Emergencies don't happen conveniently. But overall, this is a really good lifestyle. The pay is great. I get lots of vacation time, but I like it. I recommend it. It's a good time. So yeah, that's what an anesthesiologist does in a nutshell. Hopefully that was fairly entertaining and informative for you. If you have any questions for me, please don't hesitate to DM me. And again, I talk live Wednesdays and Sunday evenings. Again, links are all in the description below. So please come hang out with us, and I look forward to seeing you all. Thanks for watching.